Hello, I'm Debbie Riley, CEO of the Center for Adoption Support and Education CASE. I'd like to welcome you to a very important initiative, the National Adoption Competency Mental Health Training Initiative, NTI. This 5-year federal grant, funded through the Children's Bureau, Administration on Children and Families, Department of Health and Human Services, is intended to improve the well-being outcomes for children and youth moving to adoption and guardianship, as well as providing support and appropriate therapeutic interventions to ensure stable and secure post-permanency experiences for children and families from all adoption experiences. The research and practice supports that while there was a need for adoption competent services, there was a dearth of specialized trained mental health providers to meet this growing need. The feedback from families was really clear. They wanted adoption-competent mental health services from practitioners that truly understood the nuances of what it means to grow up in foster care and orphanages, the impact of traumatic beginnings, the impact of separation from one's family and culture of origin, transracial and transcultural challenges, the importance of their adoption stories, how to manage the profound loss and grief, and the complexities of one's identity formation. They also wanted mental health professionals to give them the tools to parent children successfully, to understand that adoptive parenting is very different than biological parenting, and most importantly, not to be blamed for things that they were not responsible for. Through this innovative training, child welfare professionals and mental health practitioners in all states, tribes, and territories will now have access to standardized, web-based, evidence-informed training. By providing you with a specialized lens in adoption competency, we believe you will be more effective in addressing the mental health needs of children and families experiencing adoption or guardianship, enhancing your skills in clinical assessments, treatment planning, and evidence-informed interventions. The NTI training embraces the work of so many experts in the field who have dedicated their careers to better understanding how we could improve the outcomes of children whose lives have been impacted by the experiences of out-of-home care and adoption. If you're a seasoned therapist, this training will heighten and broaden your knowledge and skills, adding a new layer of expertise to your practice. And for those of you who are newer to clinical practice, I'm really confident that this training will provide you with an innovative toolkit of skills and strategies to build your practice with this population. For the past 20 years, CASE has had the honor of building an array of adoption-competent mental health services, responding to an unmet need voiced by foster and adoptive families across our country. As a clinician myself, I've seen the overwhelming positive outcomes when this knowledge is infused into clinical practice. My hope is that all of us together can build the capacity to meet the growing needs of the families we serve, and ultimately improve the outcomes for the children we all so desperately care about. Thank you so very much.